Good evening and welcome, faithful justice seekers. I am Sister Eilish McCullough, and I serve on Network's grassroots mobilization team. As I was watching everyone log in as the list of participants keeps growing and growing, I'm reminded that we are all in this together as we are working to ensure that the programs that support our communities are protected and saved. I know that we're doing this work together. Now, tonight, our registration list spans the distance of the United States. And at this moment in time, we need each other as we work to protect our families, our communities, and the people we love. So, as the Senate is heads down and focusing on budget reconciliation, we know that we have to mobilize ourselves so that we can help our communities know what is going on, so that we can help our friends, our family members, and others advocate for the policies and issues that we believe to be the most important. Now, tonight, my colleagues will be sharing more about the cuts to SNAP and Medicaid, Medicare, the child tax credit, and all the funding that they're trying to give to immigration enforcement, the things that we saw in that House budget reconciliation bill. And we're going to talk about where we are now that we're here in the Senate. We will also have a chance to learn about effective messaging because, as I said before, we know that advocacy works. As we begin tonight, just a quick reminder. If you have any questions or answers, you can put them in the Q&A box at the bottom of your screen. We'll answer as many questions as we can get to near the end of the webinar. And as a reminder, if you have a question that we just don't have time to get to tonight, we will make sure to email you back with a response. Tonight, I am proud and excited to share the Zoom screen with 7 of my colleagues. You'll hear from 4 members of our government relations team: Laura Peralta Schulte, Ralph McLeod, Jarrett Smith, and perhaps most exciting is introducing our newest colleague, Giovanna Oaxaca, who serves as the Senior Government Relations Advocate on immigration. We'll also hear from Communications Coordinator Virginia Shielder and from my colleague on the Grassroots Mobilization Team, Meg Olson. And as we begin tonight, I'm going to turn it over to Jo Neal, who serves as our Interim Executive Director, and she will welcome us in prayer and grounding. Welcome, Joan.
Thank you, Sister Eilish, and good evening, everyone. Thank you all for being with us tonight. This is another critical moment in our country's life, and it is important for all of us to know what is at stake in this budget reconciliation process. Here we are, closing in on 6 months since this administration took over the government and legislative bodies, and this has been perhaps the most chaotic early days of an administration in our lifetimes. But more importantly, this time period has witnessed the worst attacks on we the people, those of us who are not millionaires or billionaires, that we have seen in modern history. And now we see the plans to codify these cruel, power-grabbing, illegal, and immoral policies into law through the passing of a big, bad budget bill. We must not let that happen. Now, I'm sure you all have a basic understanding of many of the elements contained in this bill, but tonight we want to go into some detail about what is really at stake should this bill pass in its current form. We want you to clearly see how it will hurt all of us, who it will hurt the most, and why we must not allow it to pass the Senate. Plainly spoken, this bill is morally repugnant and will bring pain to every community in the country. We must not let lawmakers take away our health care, diminish our food security, decrease affordable housing, and destroy family security. We must not allow legislators to hurt hardworking families, people with disabilities, kids, seniors, and others who need the life-affirming resources that our national budget provides. These are our family and our friends and our neighbors. We must show up for each other and speak out against those who would take money from our shared budget to give tax breaks to billionaires and large political donors, to fund illegal, unconstitutional deportations of our immigrant sisters and brothers, and to enable the most political grift in the history of our nation. My friends, Dr. Martin Luther King Jr. said, budgets are moral documents. Show me your budget and I'll show you your priorities. Well, these lawmakers have shown us their budget, and it tells us exactly who they are. Let me be clear. This is not just a normal partisan budget fight. This is a battle for the moral compass of our country. This is a battle for the 34 million children who will suffer from the cuts to Medicaid and SNAP, for the 4.5 million children who will no longer have access to the child tax credit, for the 13 million people, including families and seniors, who will lose access to health care. This is a battle for our family members, our friends, our neighbors, and maybe even some of us gathered here tonight. So this is the moment, this moral moment is what we are facing right now. This is the moment that calls for moral courage, human decency, a sense of solidarity, and a commitment to the values of our faith, particularly as they are expressed through Catholic social teaching. So as we approach the feast of the sending out of the disciples over 2,000 years ago, let us pray that the Holy Spirit will embolden us, as she did on the first Pentecost Sunday, to go out and tell all the people that we are called to love one another as we love God and ourselves, that there are enough resources in this land for all of us to thrive, no exceptions, and that God is with us in this important struggle, so we need not be afraid. My sisters and brothers, we begin tonight, as we do all things, in a moment of prayer, calling on the Holy Spirit to make us disciples for the gospel of love and justice. And so let us pray. Come, Holy Spirit, fill the hearts of your faithful and enkindle in us the fire of your love. Hope of all those afflicted, descend into our hearts and inflame in our tepid souls your strength and your courage. Send us forth, Holy Spirit, empowered to heal and free one another, so that you can renew the face of the earth. Amen. And now it is my pleasure to turn the program over to my colleague, Laura Peralta-Schulte. Laura?
Thank you so much, Joan. And I feel the spirit with us here today. And even though she's going to be manifesting through budget reconciliation and the chart in front of you, I too am so happy that everybody's with us today. The timing is really perfect as the work of the Senate begins. So let's go ahead and just kind of plant ourselves where we are at. Now, you all saw this chart at the beginning of the process as we were heading into the House on budget reconciliation. So let's just bring it back and make sure we understand where we are at. We know that the House passed their budget reconciliation bill right before they went out on Memorial break. That was a vote of 215 to 214, my friends. It was close, but they did go ahead and get that bill forward. So let me say that for the House process, they went through 2 and 3, and off it went to the Senate where it is right now. So remember that the Senate has to do their own process to get this bill moving forward. Now, they are going to use the House bill as a base, but there is much, much consternation about some of the provisions that we're going to be talking about tonight. So what do we know? We know that this bill is going to change, and that is why we are gathered here tonight, because now is the time to weigh into this process. They are just beginning to turn to the various chapters of the bill. We heard today that the bill text for some of the easier pieces of the bill, we will start seeing them very shortly. They are going to hold the process on some of the tougher things, think immigration, think Medicaid, think taxes, towards the end of the month. But we know that the work has been intense already. We know that there has been significant coordination between leadership in the House and in the Senate. So we have our work cut out for us, friends, and now is the time to deeply engage. Let me just talk in terms of timing. Folks may have read in the papers this morning that the president has announced he wants this bill on his desk by July 4th. That is ambitious, but remember, we are talking about the president's agenda. We are talking about significant political pressure that is going to be put on these members. So while this timing may slip, we have got to keep focused on the 4th, because that is the calendar that they are working at, and it's the calendar we've got to work out too. What does that mean in terms of process? That means that in terms of getting the pieces and parts of this bill through committee into one big wrapped up bill, we're going to be seeing this for the next couple of weeks, the pieces and parts. But we do expect that we could see a vote on the totality of the bill the week of the 23rd. So it's a tight time frame. We have everything that you need to engage, my friends, and that is just the picture that we're looking at. Let's go ahead and remind ourselves of what our priorities are here. If you can just go to the next slide. So remember, in the short term, as Joan put through the gauntlet at the beginning of this, we are trying to kill this bill. We are trying to make it go away. But we understand that this is a tall order because, again, this is the president's bill. So we're going to aim towards trying to make sure that they don't get a majority, that is just a simple majority to pass this bill. And at the same time, at minimum, what we want to do is engage in mitigating damage. So that means we are going to try to save Medicaid. We are going to try to save the Affordable Care Act. We are going to try to save SNAP. We're going to cut back that funding on detention and deportation. We're going to try to stop those tax cuts for folks who don't need them, the very, very wealthiest among us. And at minimum, we're going to try to make sure that our people are as safe as possible as we move forward. Remember, my friends, politics is math. Ultimately, it is math. So we remember that in the Senate right now, there are 53 Republicans, 53. So what does that mean? We've got to make it really hard to get a majority to move that bill forward. So that is going to be the work. Sister Alicia, if you can go to the next slide. So everybody is important, my friend, because I know we're going to get questions about what about my senators are not on this list. Look, there are only 100 of them. Every senator is important in this process because every senator sits on a committee of jurisdiction that is going to be trying to take healthcare away, going to try to, fund up detention centers, work on food programs. So any member, regardless of where you are, has a voice, has a constituency that's going to be harmed. So everybody counts. But The special focus people, we just want to make sure they are on your radar screen because they are here because they have either expressed some concern about making cuts to Medicaid or to SNAP, or because there will be some political pressure on them because many of them are going to be up in 2026. And again, this is C3 work, so we're not going to go into a different kind of space, but there is just a special political pressure that folks feel as they are heading into election season. So we've got Lisa Murkowski, we've got Susan Collins, two good Catholic members, for those of you counting. We have Josh Hawley, Eric Schmidt from Missouri, and I bet you there are quite a few folks from Missouri on this webinar. Mr. Curtis from Utah, Shelley Capito, and Jim Justice from the great state of West Virginia. We've got our Ohio member on, at least one of them in terms of the list. We've got Mr. Tillis and Mr. Budd from North Carolina. We have Dave McCormick from Pennsylvania and Todd Young, who we have been meeting with multiple times already. So this is the extra special list where they need a little bit more love to feel that pressure, but just know that everybody counts in this process because we need the senators that are not on this list weighing in, making noise, and bringing justice for our people. One other thing before I turn it over to my friend Ralph, just remember, we've got to be clear-eyed about this process. Again, because it is the political agenda of the President of the United States, and there is going to be some intense pressure. So we've got to work hard and we've got to work smart. The final thing I just want to flag for you goes back to process, but Sister Eilish does not have to go back to the beginning of the slides. And it is this: that Senate is not the end of the process. What has to happen next is that this bill will have to go through the House again. So we are in a middle stage of this process. Now, this thing could go fast, so we got to be on our toes, but we're going to give it everything we can over the next couple of weeks to kill it, or to, at least to make it better for our people. And then we have another fight in the House. So that is where we are in terms of process and politics. It is my pleasure to turn it over to Ralph on the government relations team, Ralph McLeod, who's going to tell you a little bit about SNAP. Ralph, take it away.
Thank you, and good evening, all. One of the major components, and you've obviously heard a lot about it, and you'll hear a whole lot more, is SNAP. Just as a quick reminder, SNAP is the Supplemental Nutrition Assistance Program that has helped more than 40 million Americans purchase groceries each month. For decades, it's provided an essential lifeline to many of our brothers and sisters, and possibly, as Joan alluded to a minute ago, many of us on the line tonight who have used SNAP as SNAP recipients use it as being a bridge to self-sufficiency. Next slide. In terms of what's threatened, deep SNAP cuts would worsen food insecurity, it would hurt local businesses, and weaken the ability to boost jobs in every state. SNAP is a time-honored, highly effective at reducing food insecurity and poverty, and research actually links SNAP participation to better health outcomes and to lower healthcare costs. Now, what's proposed in this double-barrel deep cuts to funding and the proposed unreachable work requirements for funding eligibility? The proposed reforms could impact millions by tightening eligibility, by shifting program costs to states, and to limiting future benefit increases. The House bill will require more SNAP recipients to work in order to maintain eligibility. Specifically, it lowers the age cap at which work requirements end from 64 to 54. Additionally, only parents with children under age 7 would be exempt from the work requirements, a significant change from the current exemption for parents with children under 18. This means that parents with school-age children as young as 7 years old, must work to keep their benefits. As people of faith, we're often faced to address the question, when did we see you? People of faith, actually, when did we see you in struggle? Well, the lives of the folks who we mentioned this evening, those are the ones right in our midst. They're children like Jalen Smith and 17 million other children in every state who are going to be suffering from these cuts. They're elders like Henrietta Jackson and 17.5 million other seniors who depend on their SNAP benefits for their daily sustenance. People like small farmers like Jay Crosby and thousands of others who are dependent on producing commodities and vegetables used by SNAP users. State budgets in all 50 states will be forced to juggle already stretched budgets and will invariably place other needed resources by our families in jeopardy. Friends, in 2025, with massive layoffs already due to high unemployment in the public sector directors as well as valued service providers, the passage of this budget as it is would have dire consequences if there are more than $230 billion cut to SNAP. It not just makes it harder for low-income families in every state to afford groceries, it would exacerbate food insecurity and many other hardships. Efforts to increase the bottom line for the wealthiest must not be borne on the backs of some of our most vulnerable siblings. And with that, I'll pass it back to Laura.
I wanted to give you a big amen because, in fact, let us remind ourselves that these cuts to SNAP into the Medicaid programs and the Affordable Care Act are directly tied to both funding for tearing our families apart and for tax cuts for folks who don't need them. So I want to give credit right up front to our friends at the Center for Budget and Policy Priorities. In their masterful way, they have taken very complex data related to the healthcare provisions in the House budget bill and really whittled them down to 5 major themes in terms of what is going to be hit if we don't make the changes we need to in the Medicaid program. So just as a reminder, the bill itself is a $715 billion cut to our healthcare systems, Medicaid, the Affordable Care Act, and in that Medicare gets whacked as well. These are the single largest cuts to the Medicaid program in our country's history. So let that sink in, my friends. These are dramatic cuts to the programs that keep our families healthy. It is important to recognize up front, as Ralph was talking about these families, oftentimes they are the exact same families who are going to be cut with the SNAP cuts. So my friends, for those really struggling to get by, this bill is absolutely terrible. So let's look at those 5 takeaways. First of all, for the first time ever, the bill would require that states institute work requirements. There would be federal work requirements. And coverage would be taken away for folks if they are not meeting that requirement. Now, friends, the data is clear. The data is clear that people who can work, by and large, are working. This is true. And so what we are talking about is not the idea of incentivizing work. What we are talking about is having people jump through numerous hoops, much of red tape, work reporting requirements that make it difficult for them to stay on Medicaid. It is also true that when you look at these work reporting requirements, where they have experimented in states across the country, the impact on those who are working has been dramatic. Why? Because they miss an email, because they forget to file a document when required, because it is so hard simply to get into the Medicaid system that they failed to get health care. So it hasn't worked well at the state level. And here we go with this bill trying to set it up for the entirety of the country and not allowing states to refuse to do this. So this would require work requirements across the states. Number 2 is that it adds barriers to eligibility. and enrollment processes, both in Medicaid and in the Affordable Care Act. So remember, this is taking away healthcare by paper cuts. Not only do you have these work requirements that are going to be new for folks to systematically and over time, could be monthly, could be a couple of times a year. States have some flexibility, have to meet those requirements. But even getting onto these programs becomes more difficult because, for example, in the Medicaid space, this would force people to be compliant with the work requirements as a condition of Medicaid, it also leaves huge amounts of discrepancy for the states to implement the criteria. And so it is really so disingenuous. We've been talking to many members of the Senate, as have our key allies, and we always hear the same thing back, which is this is not a cut. My friends, this is a cut. This is a cut that is wrapped up in red tape. They are fully aware of the fact that it is the challenge of getting health because of all of these hoops and the lack of a state infrastructure that, as CBO will look later, says people are going to lose healthcare coverage, and that is the goal in terms of trying to drive some savings on these programs. Number 3, it takes coverage away from immigrants living lawfully in the United States. My colleague Giovanna is going to take a deep dive into this issue for you, but just suffice to say that some states in the United States have expanded health coverage to legal immigrants using their own dollars. So this would restrict the ability of states to go ahead and do that. Number 4, it adds new out-of-pocket costs for many people, both in the Medicaid space as well as in the affordable care marketplace. Let me give you an example. So for the first time, the bill would allow states to charge as much as $35 for each healthcare provider visit. Now, for somebody who doesn't struggle paycheck to paycheck, you might say $35 copay, well, that's okay. But my friends, we have got to remember who this program serves. These are people that are largely struggling to keep a roof over their head. As Ralph just said, they're going to be potentially losing food assistance. They do not have $35 to pay every time they go see their provider, their healthcare provider. And so what does this do? This is a real barrier to access for the people that we love and we care about, and we cannot let it stand. It will have a terrible impact on our people. Finally, when you look at point 5 in terms of the it fails to stop the premium hikes for the Affordable Care Act marketplace, one of the great interventions of the Biden administration was to recognize there are people on Medicaid and there's the Affordable Care Act, and oftentimes there was a gap of people who made just a little bit too much to get on Medicaid, but couldn't afford their premiums under the Affordable Care Act. So there was an innovation that was put in that allowed 4.2 million people to, for the first time, access care under the Affordable Care Act. We should be celebrating that. We know that our religious value says that healthcare is a right and not a privilege. But rather than celebrating that, the House decided not to move those premiums forward. So our people are going to be sicker. They have less food. We cannot let this stand. I do want to just say, in terms of the results down here, as so clearly stated, we are seeing roughly 15 million people become uninsured by 2034. I do want to go, before I go to my next slide, and just really raise an issue that we've been getting a lot of questions about, and that is about Medicare. Because folks, we know that many folks on Medicare are actually dual enrolled. They are on Medicare, but they get Medicaid because Medicaid covers so many important programs that Medicare does not, in particular for if they're struggling with a disability and need home care and home assistance. So what does this bill, the House bill, do? It makes it harder for folks to enroll, do dual enrollment. It adds these red tape barriers. And because they are going so hard at Medicaid, it is clear that the one piece of the budget that is discretionary in terms of home services will suffer unless the states can pick it up. So it impacts Medicaid, it impacts the Affordable Care Act, it will impact Medicare patients who use services under the Medicaid program. Let's go real quickly and then we'll switch to the, if you can go to the next slide. This is a CBO budget, just so you know where your federal dollars are being pulled out of. These are the various pieces and parts that make up the $723 billion in cuts. You see the work requirement piece on the right-hand side. The work requirements only save money, friends, if people can't get the program. So let's call a cut what it is. That is a cut to Medicaid. The eligibility rules on the bottom are the same thing, meaning if you make it harder for people to actually access their health care, you save money. So the cynical nature of this bill, where you're going to be meeting with members and talking to folks that are saying this is not a cut, the data is clear. The data is clear. Dress it up any way you want, and we are talking about a cut to healthcare to pay for things that we don't need. Let's go to the last slide. And this is Kaiser, by the way, and this is another Kaiser. Because you all are from all over the country, we want to make sure you see that there is not a state in the union that doesn't have skin in this game. And if you look at the color scheme, you see kind of the light colors through the darker colors. It is no coincidence, my friend, who is heavy, who takes some of the worst hits in this program. Look at California, look at Virginia, look at New Jersey, the Northeast. You've got a plus 13% hit to the budget, So states will have one of two choices. They will either spend up or they will cut because they will not have the budgets. You look at the blue states, I'm looking at the hand of Michigan, I'm seeing Minnesota, I'm seeing many of North Carolina. That is still a significant cuts. And then you go down. I think that is my last slide, Sister Eilish. And so I will just suffice to say the mission at hand for SNAP and for our folks that utilize healthcare, being all of us, is dire. So we want to work with you and lift our voices, because we are not leaving our most vulnerable people to the side for the benefit of tax cuts for people who don't need them and to tear apart our families. Jared, I believe you are up next, my friend. Take it away.
Thank you so much, Laura. It is a pleasure to be with you all. Before I begin with my presentation, I want folks to know my charts are from our friends at the Institute on Taxation and Economic Policy, also known as ITEP. ITEP is a DC think tank. So we gathered a few months ago and we talked about what we thought was going to be in the reconciliation bill, specifically regarding the child tax credit. Well, folks, now we do have a tax reconciliation bill that came out of the House not too long ago. This bill will focus $2,500 benefit per child for the next 4 years. Millions of children whose parents earn too little will be denied this benefit. 4.5 million kids will lose access entirely under new requirement This requirement requires all parents, that means all parents, must have a Social Security number. The cost of this bill, this big, beautiful part of the president's bill, is $790 million. We are going to see at least 17 million to 20 million kids, because their parents do not earn enough money, because this bill does not tackle full refundability in the child tax credit, they will lose this extra benefit. All right, next slide, please. All right, so let's get into where all these cuts that my colleagues Laura and Ralph mentioned, what they're doing, who they're helping, and why the Republican members of Congress and the president really want to push this reconciliation bill. So if you look at this chart, you can see that the benefits of the overall tax portion of the reconciliation bill are heavily skewed towards high earners. Those are the people in the 68% bracket there. That's the richest 20% in this country. The richest 1% of Americans would receive a total of $124 billion in net tax cuts in 2026. The middle 20% of taxpayers on the income scale, a group that is 20 times the size of the richest 1%, will receive less than half that much, $60 billion in tax cuts that year. And I hate to say it, but you can see the extremes of the distribution. The poorest fifth of Americans will receive only 1% of the bill's net tax benefits in 2026, while those in the wealthiest column there will receive a huge majority of the tax benefits that are coming out of this bill. Next slide, please. So how does this translate into your tax cuts, or how much would you not have to pay in federal tax obligation? Well, the richest 1%, just like the previous slide, of Americans will receive an average net tax cut around $70,000. That's many, many times more than the average tax cut received by other groups in this chart. While those who make less than $26,900 will only see a $130 deduction in their annual tax liability. That's just for income taxes. There are other hits to people when it comes to the federal government policies regarding student loans. In this time of college graduation, I want to leave you with the impact on those who have taken out loans to pay for college and the future cost of education. This bill hikes borrowers' student loan payments. Under the big, beautiful bill, the average borrower a college degree would pay an additional $2,928 per year. That's on top of having, once you get out of college, you may not get, that high paying job. So you might be in the poorest or the second sector in this graph above. So you would have, in addition to that extra $2,928 that you would have to pay, you would have your actual tax benefit cut would be less than $730. Furthermore, the reconciliation bill limits eligibility for Pell Grant recipients. 4.4 students could be required to pay an extra $7,400 for a bachelor's degree, or $3,700 for an associate degree. So you can see that this proposal, the tax portion of the reconciliation bill, is a giveaway to the wealthiest people, wealthiest corporations in this country. We need to make sure that we use all our resources. And at the end of the webinar, when it's time for the action that needs to be taken, we need to push back on this, because this is immoral. The amount of money that is going to the 1% and even the 4% of this country when it comes to the tax giveaway. So I want to thank you all for joining us this evening. I will now toss it to my colleague, Gio, who will talk about immigration.
Thanks so much, Jarrett. Hi, everyone. I'm really pleased to be back at Network here as the new government relations advocate on immigration. And there is a lot to discuss. So what's in the big bad bill that we are all getting to know a little bit better? It's a once in a generation threat to families and communities across the nation. It significantly expands the federal government's power to carry out detention and mass deportations. It also raises the cost of maintaining legal status and work authorization while eliminating access to vital services for certain immigrants, like Laura was mentioning earlier. This legislation provides approximately $150 billion for immigration and border enforcement over 10 years. It's effectively prioritizing punitive measures and draconian enforcement over sound immigration policies and federal resources that make our communities stronger. These are grouped primarily into three titles: the Homeland Security title, Judiciary title, and Armed Services. The increases in spending in these areas make up about $230 billion of the overall cost of the reconciliation package, according to Penn Wharton estimates. So you can see how significant a portion immigration is to the overall price tag on the reconciliation package. Let's take a closer look at three types of spending / offsets in this bill and what this means for families. First, looking at funding for immigration enforcement. Second, expansion of immigration fees. And third, exclusions to vital programs that jeopardize the safety and health of immigrant families. Next slide, please. This is just a slide so you can see some of the numbers. I'm going to be throwing a lot of numbers at you today. Unfortunately, you don't have to remember all of them, but there is spending. There are multiple accounts that spend over 1 billion, multiple accounts that spend over 100 million, and very excessive fees that we also want to talk about. So next slide. Next, thank you. So even before this bill's passage, there has been growing concern across the nation about this administration's aggressive immigration enforcement tactics amid what we have seen to be many cases of due process violations, individuals with no criminal history being swept up in worksite raids outside of the courthouse, and even just for exercising the right to free speech. So in a single day last week, ICE claimed that they arrested 1,600 individuals, but now there are government officials pushing for 3 times that amount. I won't say names, but you can guess who. In addition, the administration has an overarching goal of 1 million deportations per year, and the government is well on its way towards reaching that goal. As of in the first 100 days, the administration had arrested, according to their statistics, 66,000 individuals. To increase arrests and deportations, ICE is in need of funding for jail and detention beds, new officers and agents, and government lawyers to forcefully pursue removals in court. This reconciliation is not just big and bad, it's also a fire accelerant. Once unleashed, the fire spreads rapidly, leaving behind widespread collateral damage and mounting costs. So we're going to highlight just a few of those accounts and how this bill would aim to complete this mass deportation agenda. First, there's about $45 billion for adult and family detention to maintain approximately 100,000 detention beds annually. It's also really critical to note that there are no guardrails on the duration of detention for children in what would be a really significant policy change from longstanding practice. There's also approximately $14.4 billion for actually doing deportations. There's about $8 billion for 10,000 new immigration and customs enforcement personnel / investigators. about 1.32 billion for government prosecutors, an addition of 950 million for state reimbursements for jailing immigrants with criminal convictions, as well as those with civil violations, and 650 million to facilitate state and federal partnerships on immigration enforcement, which are not a requirement for any state or locality to have, but something that this administration has aggressively pursued. It does include an amount of funding for the care of unaccompanied children, but within that, 100 million of it is for their repatriation. Next slide. On immigration enforcement and the border, it increases militarization at the border, which we know is deadly and expensive. There's about 46.5 billion for approximately 2,300 miles of new and replacement border wall and barriers, as well as a significant number of funds for border security enhancements, agents, and including $5 billion for DoD operations and detention. Next slide. Next, we're going to talk about the expansion of immigration fees, because this is very striking to me. Just as the administration is trying to, make people leave the country or force them out through deportation and family separation, it is also increasing the cost of maintaining a legal status by adjusting fees for people who want to apply for immigration benefits and work authorization and all sorts of things. Importantly, these funds will not all be going back to making the immigration system more efficient or navigable for anybody. A lot of this will just be going back to the Treasury in a slush fund that can be used in all manner of different ways. The fees in question will have a disproportionate impact on low-income adults and families filing for humanitarian protection. This includes a new $1,000 fee for applying for asylum, plus $550 for applying for a work permit, $1,000 for parole application, plus $550 for a work permit. You also have approximately $8,500 for an individual who might be interested in sponsoring and supporting an unaccompanied child. Within that $5,000 is a penalty if the child does not appear in court. There's also $500 for any child who has been abused, neglected, or abandoned, who is abandoned by one or both parents, who is filing for special immigrant juvenile status. So just to name a few of these humanitarian applications that would increase in cost. There are other fees that would apply to international students, diversity visa applicants, people who are filing for waivers, court continuances and appeals, as well as even folks who are just applying to get their green card. If this was a statement of values, it's really clear these fees are about prioritizing less migration and making the United States a more closed-off nation. Last slide, please. Laura mentioned this at the beginning, but there are significant exclusions proposed in the reconciliation bill. And this is a good time to remind everyone that most undocumented immigrants are ineligible for federal public benefits. This bill seems to recognize that, so instead it goes after a lot of programs that many lawfully present immigrants are eligible for. These are groups of people like refugees, asylum seekers who have received refugee status, people who have been granted parole, survivors of trafficking and domestic violence in the United States who are granted protection. All manner of people who have lawful presence and under the laws are eligible for a certain type of coverage. Specifically, this bill would make it harder for states who actually use their own funds to cover people who are not lawfully residing in the United States. So the federal government would take away federal matching dollars for states that offer coverage to undocumented individuals, like a penalty of sorts. It also ends Affordable Care Act marketplace coverage eligibility for DACA recipients, and it also ends marketplace coverage for other lawfully present immigrants that are currently eligible. In addition, it ends Medicare eligibility for many lawfully present immigrants, except for groups like green card holders and a handful of other groups. Immigrants already have some of the lowest participation rates in insurance. Bills like the reconciliation package will only make it harder for communities and individuals to obtain healthcare coverage and stay healthy. It's very clear this bill just is shifting away resources from working class families by weakening the social safety net And it's funneling all these federal dollars to private corporations for things like detention and deportation. So I will urge you to keep this in mind as you take action. So turning it over to Virginia.
All right, thanks, Gio. So while there are hundreds of us on this call tonight, the majority of the country is not on our webinar and may not be hearing the important and accurate information about this bill that we're hearing. So how do we spread the word then? How do we talk about this in our communities? And luckily, we have a lot of data-informed strategies that tell us the most effective ways to talk about this bill so that we can build energy in our communities to put pressure on our senators. So we at Network have distilled that guidance into a budget reconciliation toolkit that contains a key message and narrative, some messaging tips that I'll talk about in a moment, as well as some sample social media posts and graphics. And this is for you to use really in any like public facing content you're writing or event. So you can use this guidance if you're writing letters to the editor, if you're making social media posts, if you're speaking at a rally or a press conference, or even if you're writing something more kind of casual like a flyer or an event invitation. Next slide, please. So we know that our messages work when they spread, and they spread when they're repeatable. So it's really important for all of us to have a consistent message that we're sharing in our communities. So I'm going to read through our key message and then I'll break it down a little bit. So we are telling our communities, don't let some lawmakers take away our Medicaid and SNAP to fund tax giveaways for billionaires and tearing families apart. Join us in calling on our senators, name and name, to protect our healthcare, our food, and our families, and oppose the budget reconciliation bill. All right, so let's break that down a little bit and go to the first sentence. Don't let some lawmakers take away our Medicaid and SNAP. So the data right now is telling us that the language of take away is really compelling to folks. As you can imagine, people really don't like the idea that Congress is taking away something from them. So using that language immediately makes our message more compelling. But then we have to show why some lawmakers want to take away our Medicaid and SNAP, right? And it's so they can hand that money to the richest people among us and detain and deport our immigrant neighbors, right? So we need to be making those connections for people in our communities that these cuts to Medicaid and SNAP are so they can give money to the richest people. Then we move into our call to action. Join us in calling on our senators, and we always want to include them by name so we can be really specific about who we're targeting. And our ask is really clear. We want them to oppose the budget reconciliation bill. But in messaging, we never want to just say what we're against. We also want to say what we're for. So it's not just that we oppose this bill, it's that we oppose it so we can protect our healthcare, our food, and our families. It's also good to remember that unlike many of the people of this call tonight, most people are not really energized around budget bills, but they are energized around healthcare, food, and our families, right? So here's our key message that we want to be consistent on. Next slide, please. And I just want to lift up two more tips. The first is that, we don't want to talk about why, we don't want to only talk about why these cuts are bad. We want to talk about why SNAP and Medicaid are good, active goods that bring concrete things to our communities. And we want to describe those things as vividly as possible. You want to bring it into people's kitchen tables. So instead of saying, oh, SNAP prevents hunger, which is true, you can make it even more vivid by saying SNAP helps families put food on the table or helps kids have a nutritious breakfast so they can focus in class, right? Medicaid helps us afford our prescription medications and not have to skip doctor's appointments. Personal stories are a really good way to help bring to life those concrete goods, whether it's your stories, someone in your family, someone you know, or of a local service provider, like a clinic or a food bank. Second, our opposition's messaging strategy right now really seems to be centering on just telling people that these cuts won't affect them. And of course, we know that that's a lie. So without repeating that lie, we can counter that message by emphasizing how these cuts will impact our state, our communities. And in the toolkit, we have, along with more tips, we have links to resources that help you see exactly how your state and your locality can be impacted. Next slide, please. All right, lastly, I just want to reiterate again that our messages only work when they spread. They spread by being repeatable, and they're repeatable when they are clear and succinct, right? So these here are a couple of examples of the graphics that we've created that are all linked in the toolkit. You can print them out, you can use them as signs, you can paste them around your neighborhood, you can share them on social media. These are how we will spread the word and build pressure on our senators in our communities. And with that, I will pass it off to Meg.
Thank you so much, Virginia, and thanks to all my colleagues for all of this important information, and to you, the almost 500 advocates who have joined us this evening. As you heard from Laura at the beginning of this webinar, our goal at this moment with this horrific budget reconciliation bill is to, at a minimum, reduce the damage of this bill and save Medicaid and the ACA, save SNAP, cut funding for detentions and deportation, and stop the tax cuts for billionaires. Phew! Wow. There is a pathway to doing this, my friends. And tomorrow you will receive a follow-up email with the slides, with the recording, and with the beautiful messaging guide that Virginia just talked about, and links to all the things I am about to briefly go over. So first of all, things that you can do. Call your senator. Tomorrow, we will provide the number and the messaging. It will be live on our webpage, and you can call every day. I have a lot of people saying, well, I live in a blue state. What should I do? Call, but also on that slide that Laura has the key states. If you know friends and family in the key states, get them to make those calls too, okay? You'll have everything tomorrow to do that. Next thing, write letters to the editor calling on the Senate to protect SNAP and Medicaid and our immigrant siblings and the child tax credit and all of these things. This will also be in the messaging guide that Virginia has put together for us with our colleagues, and you'll receive tomorrow. If you are in one of those key states, and that's Alaska, Maine, Missouri, Utah, West Virginia, Ohio, North Carolina, Pennsylvania, or Indiana, please, please, please join Network on virtual lobby visits. Jared is scheduling them right now. You can join us and our wonderful interfaith partners. And you can come on a visit. We will provide you with everything you need, the talking points, the leave behind, and we will prep you so you are ready to go. And last but not least, you just saw those beautiful signs that our colleague Colin made, and they're for you to bring to rallies and vigils. A lot of you have reached out about the No Kings rallies on June 14th. Network is very excited to sponsor that, and we would love for you to, when you get the link tomorrow, to print out these signs. We have various different sizes, and you can bring them to the rally. You can pass them out to your Catholic friends and share our special budget reconciliation messaging with everyone around you at those rallies. And bonus, take photos, send them to us so we can post them out on social media, and of course you can post them on your social media. So there you go. We have time for a few questions, so I'm going to pitch it back to Sister Eilish.
For our Q&A, I invite all of our panelists to come back on the screen to answer questions. Now, the Q&A was flying during this webinar, and we don't have a lot of time for questions and answers. So we will make sure to get you all the follow-up information in an email. But let's see, first, our first question is, if this Congress votes for so much money for 10 years of draconian immigration measures, can Congress, in a possible Democratic administration to come, or another administration, vote to get rid of the funding before the 10 years are up? So I think I will probably pitch this to Gio.
I'm sorry, I would have to turn it over to another
Or
more
Laura.
expert person on reconciliation.
I'm
Yeah.
not sure in terms of grabbing funding back. I mean, theoretically you could, but you know as well as I do that once funding goes out, it is easier. It is harder to change a funding structure than it is to stop a funding structure. And I would just say one thing to Gio's point. She was already talking about how they're fast tracking. They already have contracts that are set to fulfill some of the deportation and detention stuff. So it is literally kind of already worked out in terms of the spend. So might we grab some back? Potentially. But I think I'm deeply concerned that they fast track it so quickly that in fact, they spend it in their 4 years. Gio, I hope I did that well enough. That's a bit of a punt, but that's the best I got right now.
I would just add that, it would be difficult to get consensus. You have to get, if you're doing another reconciliation bill, you got to get at least a simple majority. If it's regular order, then, it's going to require 60 votes in the Senate. So it is tough. Once the spigot is open, it's very, very difficult to shut it off.
So this next question is, with Laura, when you were talking about Medicaid, this question is the first part's about Medicaid.
Perfect.
Will these cuts that you referred to affect new enrollees, or also include current recipient, or only include current recipients? And will the red tape also impact the renewal process for current enrollees?
So really all three of those subcategories get hit. Remember, their goal is thus, is to make it hard to get on the program. So anybody new, they have to meet certain requirements before they even get onto the program that don't exist now. Then they will have incremental checks in the system to make sure that you are complying with the intent to get people off of it, frankly. So anybody new hits that hurdle. They are making it very hard to re-enroll through both work they're doing administratively in terms of that whole process, as well as through the reconciliation bill as it currently stands. And what was your third piece?
Okay, so then the third piece to that, I am getting back to the question. The renewal process for current enrollees.
Yeah, and just suffice to say that they are trying to shake the system at all points of entry and as people re-up as well.
Okay.
I did see also a comment or a question in the chat about Medicare. We will follow up with very detailed information on that. The real crux is for people who have dual enrollment. That is 12 million people living in the United States. And so that is not a insignificant number. And it relates specifically to homebound services and It's horrible. We're gonna get rid of that.
Mhm. Now, we could spend another hour on tonight answering questions. There's questions about immigration and SNAP and messaging. And so just the one kind of last question that was repeated in a couple different ways in the chat, in the Q&A, is one of the things that we keep hearing, and I know, we've talked about it at Network, is that there are some members who say these cuts are not going to affect our state, or they were promised they won't. So we know that part of it is in messaging that Virginia talked about. But can you all reiterate, like, these cuts will touch every single state in the country? And just maybe a little tip about how can someone respond to their member of Congress, whether it's a senator or a representative who's saying that you don't need to worry.
I mean, you
I like to
just,
tell folks to
oh, go
approach.
ahead, Ralph.
Go ahead,
Sorry.
to approach
Go.
the whole state versus state is the way we approach the borders. I mean, the reality is asking who is my neighbor because the person is in Oklahoma instead of Arkansas, and if a child is denied benefits there, I mean that's a problem. That's something that should keep me up at night as well. That we not become comfortable or complacent because we think our house is in order and the house next door is on fire. I think there's a danger there. So I think that and with the world being as small as it is, with communication systems, all of us know people in other portions of the country that we can engage and we can inspire and we can encourage to advocate.
Thank you so much, Ralph.
And
And
I would
Jared.
just add that, the number is so large, it's going to affect everybody. I mean, these aren't like, nip and tuck changes. These are dramatic changes to health and nutrition programs. And even just, the things that I talked about regarding school education. I mean, it, it it's not just paying to get to school, the tuition. You got to pay for room and board. You have to pay for food. I mean, there are a lot of costs that go into school. And with the federal government saying that they're going to charge you even more money, I mean, it just forces a lot of kids, a lot of people that are going back to school, even more behind when they finish because it's debt and you owe it, you got to pay it back. And you may or may not get the job that is gonna make enough money that you can pay for these extra costs. I'll just say, in closing that, one, thank you so much for spending time with us this evening. We really appreciate it. The Republican Party, and the president, they want to reshape the social services that we have counted on for 50 plus years in this country. You're going to hear a lot of rhetoric about this is fraud, waste, and abuse. If it was truly fraud, waste, and abuse, then the Doge guys would have figured all this out in the few weeks that they're around. They can't figure it out, right? These programs that are helping people are there for very, very good reason. And we have paid into these programs with our taxes for many, many years. So people should be able to draw upon Medicare, Medicaid, SNAP, WIC, other types of benefits to help people that are in need in different, times of their life. So we should not penalize people because they can't make a certain income. Everybody, you would hope everybody could make, 100,000, 150, $300,000, whatever your dream is. But that is not the reality in this country. So we have to have these types of programs available so that if you are sick, you can get help. If you are hungry, there is food available for you. Because as the wealthiest country in the world, we should not leave anybody behind. Thank you.
Thank you so much, Jared. And now I am going to turn it back. I'm going to share my screen again and turn it back to Meg.
All right. Well, thank you, everyone. So if you've ever been to an organizer training, you have learned that the definition of power is organized people and organized money. So I am here tonight to ask for your support. Hopefully you want to support our work in any way, shape, with any contribution of any kind. And you'll see here that we have 94,000 supporters. What does that mean? That means we have 94,000 people in our database who receive our emails or our mailings or anything like that. However, you see we have around, maybe more, like probably some more than this, 5,600 members. Members pay their $50 a month or 20 if you're a senior student or receiving on a limited income. What does it mean that you're a dues paying member of Network? That means that you receive our Connection magazine 4 times a year. It is award winning, by the way, by Catholic Media. Has won many awards. And you also know that by being a member of Network, you are increasing your commitment to us, whether it's $50 or $20. And of course, we welcome donations of any size. So please, please go to networklobby.org/justice seekers and support our work in this moment. We need your calls, we need your advocacy, and of course, yes, we also really need your dollars. So thank you all tonight. And you'll be hearing from us tomorrow with all the follow-up that you need to go forth and do this great work. And my friends, we will make this bill better. All right. Have a good evening. And one last, join us for these upcoming events. A lot of people are asking. June 10th, we will be at the US Capitol with our Christian partners, having a Pentecost witness for a moral budget. This is being organized by Reverend Jim Wallace and friends. June 24th, Catholic sisters coming in from all over the country for Sisters Speak Out. And then our June 28th, and this invitation's going out later this week, is our White Supremacy and American Christianity, Faith or Fascism. So lots of ways to continue joining us in person and online in June. All right, my friends, have a good night.